Is being called a medical breakthrough for children with peanut allergies. The Food and Drug Administration just approved a first-of-its-kind medicine to help children who have allergic reactions to peanuts. So the new drug is called Palforzia. It can be used for children between 4 and 17 years old. It's designed basically to minimize the severity of a child's allergic reaction. Joining me now to explain how this drug works exactly is Dr. Megan Brown, an emergency medicine physician with Memorial Hospital. Good morning. Thank you for being here. First of all, your reaction as someone who no doubt has treated someone who's come into the ER with a severe peanut allergy, that this is now on the market and available for people.
It's exciting. It's a brand new thing, first of its kind. So we get kids that are really sick, so hopefully this will help.
How does it work? Because it's not a cure.
No, it's not. So it's kind of like all the other allergies, except for other allergies you can get shots for. Yeah. Food allergies, it's a little bit more difficult. So this is a 3-step process, and it's a desensitization. So the kids will go in, the very first dose they get has to be with the medical care. Because if they have a severe reaction, then it can be taken care of. And then their dose is increased for 3 stages, and each time they increase a dose should also be in medical care so that they can make sure that there's no reactions. And then
so it's basically giving them a little bit of,
yes,
of the nut, you know, or the peanut.
Yeah, it's peanut flour. Yeah. So yeah, each time is an increase in the dose, and then the 3rd phase is maintenance, and they have to take it every day.
And it's oral. Mm-hmm. Correct? And then, so that illustrates then it's not going to necessarily work for everyone. So at any point then during that 3-step process, obviously become obvious if it works or not.
Right. If they have, obviously if they still have a reaction to it, some people can have too severe of a reaction to it and they just can't tolerate it.
So I'm making an assumption here that this is specifically those who maybe carry an EpiPen. Some may not have as much of a severe reaction to peanuts as others. Does this pretty much, would this work hopefully maybe for everyone in that category? I know it's so hard. You don't really know.
It should. It should work for anyone. Obviously the kids that have an EpiPen are the more severe kids. Peanut allergies they tend to be more severe than your regular allergies anyway. So anyone who has a peanut allergy, whether it's just a simple rash that you get on your arm or if it's actually have a problem with your breathing, they should be carrying an EpiPen. So this should help for all of them.
It's interesting too, I think, because you know, there are some children who may not, because this is for kids 4 to 17, who may not even realize they have a peanut allergy. I mean, is a peanut allergy, is it genetic? You know, if I were allergic to peanuts as an example, would that mean that my child could be more increased risk of having an allergy?
So allergies are not hereditary, but yeah, there is, some of the allergies can have an increased risk. I don't think that peanut allergies is in that category. And yeah, but peanuts are in so many things.
That's what's so hard about it. It's not just peanut butter.
Right.
You know, you have to read every single label as a parent who has a child with that allergy.
So a lot of times they find out that they have an allergy pretty early on because it's in so many things. And baked goods are the kind of a nice tip. They try that and there's peanuts in it.
So is there something then, you know, maybe someone who's thinking about starting a family as an example, you know, a reminder? I mean, I always knew when I had my kids, you know, I didn't give them strawberries, I didn't give them peanut butter for this very reason. But for preventative for parents at home who may be thinking about having a child and are not yet parents.
Yeah, I mean, I would obviously not do it like the first year. And then as you start introducing foods, you just want to, for any allergies, you want to be very careful of introduce one thing at a time and keep in mind that there might be an allergy to it because they could be allergic to anything.
Well, sounds like a breakthrough. It'll be interesting to see as we see more and more, you know, patients who try this, see what happens.
I'm excited.
Oh, what a life-changing for many children who maybe feel like they're a little ostracized because they go over to a sleepover and there's certain things that they can't eat because their parents are nervous about it. Thank you, doctor, for being here. Do appreciate it. If you missed any of this interview, by the way, or you'd like to read more about the newly approved drug, head to our website, news4jax.com, and look for this story under the health section.